Hi, and welcome to Healthy Living. My name is Cheryl McWilliams. With us today on the show are three very special guests who are going to be talking about a topic very near and dear to my heart, the topic of diabetes. We've actually covered this particular topic on the show before, but today we're going to be talking about it from a different perspective, from the perspective of individuals who live with it, struggle with it every single day, and have found a way to help themselves in a very meaningful way. So with us in studio is Dr. Timothy Howe, who's a medical director of wellness at Parkview Adventist Medical Center. He's an internal medicine specialist, and he's also the medical director of the diabetes program. We also have in green here, lovely green, Diane Haynes. And Diane, I understand that you're type 2 diabetic. And we have Deb Gragan, who is a type 1 diabetic. Correct. So we've got a type 1 and a type 2. Dr. Howe, what's the difference?
That's a great question, Cheryl. Type 1 and type 2 diabetes both give you the same problems at the end if they're uncontrolled, but they're very different. Type 1 diabetes we used to call juvenile onset or childhood onset diabetes, and it often begins in childhood, though not always. It's characterized by a pancreas that fails to make insulin. It's an autoimmune process where the body destroys part of the pancreas that makes insulin. Those people don't make any insulin. That type of diabetes is not reversible. Wow. It's treatable, but it's not reversible. Type 2 diabetes, the kind that Diane has, is very different. It is usually adult onset, though we're seeing it more now in children. And initially, the pancreas makes more insulin than usual, but the insulin doesn't work well. We find that type 2 diabetes is usually reversible, almost always reversible when caught early. In the later stages, it may not be reversible.
Okay, so type 2, the pancreas in most cases is still functioning, but not functioning well.
The pancreas is functioning actually very well in type 2 early on, and it's making more insulin than normal. Often on early diagnosis, we find that the insulin level is high, but because of things happening in the body, the insulin isn't working well. And if insulin doesn't work well, you need more and more and more of it. Eventually with type 2, if you don't correct the dietary problem, what happens is the pancreas wears out and they become more like type 1.
Okay, and then for type 1, the pancreas, as a result of some autoimmune thing that we're not really sure about,
that's correct.
It stops working altogether.
It stops working altogether, and if a type 1 diabetic doesn't take insulin, their life expectancy is 6 months.
Okay.
So it's critical that a type 1 take insulin.
Okay. So Deb, I understand that you have type 1 diabetes.
I do.
You've had it, I think, since the age of 8?
Correct.
Okay, that's quite a while.
It is.
You lived with this, you struggled with this for quite some time, and then you met Dr. Howe. Tell me what happened.
Well, Dr. Howe brought a whole new perspective to my illness. I've been with Dr. Howe for about 20 years now. In the beginning, my A1C, which is a 3-month average of your blood sugar, was something like 9 point something. And
wow.
The normal is they don't like it to be above 7. So right away he started working on that. And over the years I've had problems because of the diabetes. I've lost sight in one eye. I've had a kidney transplant. And my circulation is poor, in my legs especially. And so last December he asked me to go on a special diet and try it for 2 weeks. And I've been doing it for almost a year now. And one of the things that has happened since is I had no pulses in my feet when we started. And after 2 weeks of following the plan, my pulses came back.
Let me stop you right there. So she had no pulses in her feet. That's kind of a big deal.
Yeah, it is. In fact, what really started me down this track, I was rather desperate because she was starting to get signs that she was going to lose part of her foot. The capillary refill was very poor in her feet. And
So we're talking about blood getting to
yeah,
her
she
feet.
wasn't getting blood to her feet well. And what happens in diabetics, eventually you start, carving off toes and then, the front part of the foot, and then pretty soon you end up with an amputation. And Deb and I were born the same year, and, I don't like people my age to be getting sick and losing feet. And so I said, Deb, would you consider going on a diet that in many people has improved circulation? And she was willing, and her pulses came back, which means the blood flow to her feet markedly improved in a course of 2 weeks.
Okay. Is that related to the blood vessel? How does that work?
That's a fascinating thing. What we found is if you change the diet and eliminate all refined fats, the body regains the ability to dilate arteries. And even though her arteries were narrowed, are still narrowed, I'm sure, she's regained the ability, because of eliminating free fats, to dilate her arteries. And now when the body calls for more blood, she can dilate those arteries and get more blood flow to her feet, to her eyes, to her kidneys. It's not just the feet that have improved, although that's what we were working on. Deb, what happened to your kidneys?
Oh. My
kidney, I should say.
Yes, my kidney transplant.
Yeah.
I have had a kidney transplant. It's going to be 15 years old next September.
Wow.
My creatinine had gone up as high as 2.4. And in the last 3 months, my creatinine has gone down to 1.8.
Yay!
Yay.
That's awesome.